Thornton, and today is February 2013, and I'm doing an informative speech on prescription drug abuse. Imagine you have just undergone major back surgery and are suffering from severe pain. The surgeon prescribes painkillers to minimize the pain and discomfort. After 6 weeks, the pain has not improved. However, the physician refuses to provide any additional medication for fear you may become addicted. In desperation, you begin to seek the relief you desire. Doctors refuse to provide a prescription for the painkillers, leading you to family and friends. After much negotiation, they illegally sell you the desired medication. Months later, the pain is gone, but the feeling the drugs provide is causing an overwhelming desire to obtain the medication. Soon, you begin to ache for the feelings provided by the drugs and will do whatever it takes to satisfy the ache, even if it means buying them illegally or stealing them. Eventually, you long for the medication and its effects at all waking hours. You've become addicted. This, ladies and gentlemen, is an illustration of America's addiction to prescription drugs. Understanding what qualifies as abuse, the statistics related to the abuse, and the factors contributing to the abuse are vital to get a complete understanding of America's addiction to prescription drugs. First, let's take a look at exactly what qualifies as prescription drug abuse versus normal use. Prescription drug abuse is defined as the non-medical use of prescription medication in a way not intended by the prescribing doctor. There are 3 classes of commonly abused prescription drugs. The first class, opioids, are generally used to treat pain. The second class, anti-anxiety medication, which is also known as central nervous system depressants, are used to treat anxiety as well as some sleep disorders. And the third class, which is also used to treat some sleep disorders and ADHD, is stimulants. There are nearly 7 million prescription drug abusers in the United States. It is the second most abused class of drugs, the first being marijuana, and is abused more often than cocaine, heroin, hallucinogens, ecstasy, and inhalants combined. Some people believe that prescription drugs are safer than illicit drugs solely because they're prescribed by a licensed physician and distributed by a licensed pharmacist. However, when not used correctly, in many cases they can be more dangerous. Now that we've developed a greater understanding of what qualifies as drug abuse, let's take a look at some alarming statistics relating to the abuse. The statistics for the number of prescription drug abusers are alarming. According to a survey conducted by the National Institute of Drug Abuse, among the drugs most commonly abused by high school seniors were Vicodin and Oxycontin. In fact, 1 in 12 high school seniors reported the non-medical use of Vicodin, and 1 in 20 reported the non-medical use of Oxycontin. The increase in the number of prescriptions written directly relates to the increase in the number of abusers. As we can see by these 2 charts, since 1990, there has been a dramatic increase in the abuse of all 3 classes of prescription drugs, but these 2 charts show stimulants and opioids. In fact, in the year 2000, there were 1.6 million per month prescriptions written of Adderall, XR, and Ritalin. That number had increased dramatically to 4.6 million per month by the year 2010. And 76% of the 12 million prescription drug abusers consumed drugs that were prescribed for someone else. The number of unintentional deaths resulting from opioid overdose were more than that of heroin and cocaine combined by the year 2007. As we've seen, prescription drug abuse is a major problem amongst Americans. However, in order to develop a full understanding of the abuse, we must also realize factors that contribute to the abuse. There are many contributing factors to prescription drug abuse. 2 of them are the accessibility of the drugs as well as the common misprescribing acts by physicians. The drugs are very easily accessible and easily available. As this chart indicates, nearly 60% of those drug abusers obtain the drugs from friends and relatives, and 19.5% obtain them from drug dealers and or strangers. And because they suffer from multiple problems and generally take multiple medications, Older adults are often at a higher risk of misusing drugs and/or becoming addicted. Physicians often misprescribe to family, friends, and colleagues without patient-doctor relationships, which has led the American Medical Association to adopt the 4Ds to categorize those physicians. 4Ds are dated, duped, dishonest, and disabled. Those physicians who are dated fail to keep current on other effective treatment options. They also fail to attend continuing education training, resulting in dated knowledge. The dupe physician is the physician who fails to detect deception by a patient. They also often lack expertise in substance abuse. The disabled physician may suffer from his or her own impairment issues, often alcohol or drugs, which may impact their own judgment. The dishonest physician may find his or her schedule too full to properly devote the appropriate amount of time to each patient. They may have too many appointments, office emergencies, or other office commitments demanding their time and attention, thus causing them to seek the easy way out and do what the patient asks for rather than what's required or necessary to treat an illness or condition. As we've seen, the abuse of prescription drugs amongst Americans, especially the younger population, is steadily on the rise. Understanding factors that contribute to the abuse, realizing the alarming statistics relating to the abuse, and developing a thorough understanding of the difference in proper drug use versus abuse will help ensure you and your loved ones don't fall victim to the epidemic. Thank you.